So OSHA published a final rule on respirable crystalline silica in March of 2016, and for a lot of people affected by this rule, it just came out of the blue. But really, it's been something that has been under development for over 20 years. When OSHA develops a rule, it has to take a lot of things into account, looking at how that rule would affect all industries that would be impacted by the rule, but also, of course, the basis for the rule, looking at the potential health impacts of all the workers, the risks that they are exposed to. So we began a process back in 1997, had public stakeholder meetings, consultations with small business representatives, pulling information together from a variety of sources, and wanted to give a shout out in particular to the Silica Milling Machine Partnership. That was a government, industry, academic effort that pulled together a lot of the information that we relied on in the rulemaking for milling machines. That involved the National Institute for Occupational Safety and Health, the National Asphalt Pavement Association, the major milling machine manufacturers, and others, but they did a lot of good work to establish controls that would be effective for milling machines. But why did OSHA issue this rule? As Sean indicated, OSHA was established back in 1970, and at that time we adopted some permissible exposure limits, including permissible exposure limits for silica. But those were formulas that many people found difficult to understand. They're based upon the silica content of the material in question. They're not just a fixed number. The construction Pell that affects you is a particle count method. It's based upon a sampling method that hasn't been used regularly for about 50 years. And there is a difference, a substantial difference, in the permissible exposure limits for general industry versus construction. In construction and shipyards, the permissible exposure limit is about 2.5 times as high, which simply doesn't make sense. But most importantly, the previous permissible exposure limits didn't adequately protect worker health. Silicosis has been recognized as a health effect from silica exposure for many decades, hundreds of years really. And what that is when very small silica particles penetrate deep into workers' lungs, the effect is to form scar tissue. And over time, typically over many years when you're talking about chronic silicosis, that scar tissue that is formed impacts the workers' lungs such that they are no longer able to exchange gas, exchange oxygen at the rate they had previously been able to do. They find it difficult to breathe, and eventually it can be fatal. But there is also evidence showing that exposure to respirable crystalline silica causes lung cancer. It causes other lung diseases such as emphysema and chronic bronchitis, and also kidney disease. And there is extensive evidence showing that these health effects occur even at exposure levels below the exposure limit that applies to general industry, which is a fraction of that applies to construction. So OSHA estimates that with the new rule, the new permissible exposure limit, we would prevent over 600 deaths per year once the rule is fully effective, and that would occur because of lung cancer cases, silicosis, and other lung disease cases prevented, as well as kidney disease prevented. And we also anticipate that over 900 cases of silicosis would be prevented every year. And when we're talking about respirable crystalline silica, we're talking about 3 forms of silica, predominantly quartz. Also cristobalite, tridymite, we almost never see, but it is technically covered by the rule. And we're talking about respirable particles here, very, very small particles. These are particles that are less than 1/100th the size of a grain of sand. And we typically only see these when there are actions that fracture the silica particles, things like milling, but also use of power tools such as saws and grinders, abrasive blasting, things of that nature. You are not the only ones affected by this rule. It is predominantly a construction standard, but there are quite a wide variety of industries that are affected by this rule, looking at foundries, hydraulic fracturing, where they're injecting large volumes of sand into oil and gas wells, a number of other industries. But it is predominantly a construction rule. About 87% of the workers affected are in construction and about 89% of the establishments affected. So it's predominantly construction that's affected here. And when we talk about the Silica rule, there are two standards, one that applies to general industry and maritime, another for construction, and that's really to tailor the requirements to the specific circumstances in those industries. I'm guessing that most of you probably haven't had to deal with OSHA chemical health standards in the past. Some construction employers have in dealing with lead or asbestos or things of that nature, and there are a lot of similarities in the requirements between rules. But for most of you folks, it's probably going to be something new, but the requirements are pretty typical of OSHA health standards. And they're laid out in a format where we have paragraphs of the standard that are identified by letters of the alphabet. A, the scope indicating who's covered by the rule, B, providing definitions of common terms, and other paragraphs dealing with specific requirements of the rule. The requirements that get at controlling exposures are paragraphs C and D, and this is something new and unusual for OSHA standards because we have something called specified exposure control methods, what's commonly referred to as Table 1. And we heard early in the rulemaking process from a lot of construction industry folks that the typical approach that OSHA used in the past of establishing a permissible exposure limit and leaving up to employers how to figure out how to comply with that limit just didn't work because of the variability in the tasks that are performed, the environments they're performed in, the duration that the tasks are performed. And what we heard was that employers simply wanted to be told what exactly they needed to do to comply and be done with it and not have to worry about measuring exposures or figuring out exactly what would work in their particular situation. And that's what Table 1 is. It lays out controls for common construction tasks, and if the employer follows those controls, they are compliant with the exposure prevention requirements, exposure control requirements of the rule. The employer also has the alternative of following other control methods, and that would involve complying with the permissible exposure limit, assessing exposures, and methods of compliance following what we call the hierarchy of controls, which we'll talk about in a minute. And there are also other provisions that come into play, getting at respiratory protection, housekeeping requirements, a requirement for a written exposure control plan, and medical surveillance in some circumstances, as well as training and record keeping. But since we're in the construction industry here, we'll be talking about the construction standard, and that applies to those construction activities that are going to generate respirable crystalline silica exposures that exceed 25 micrograms per cubic meter of air as an 8-hour time-weighted average. That's meant to exclude a lot of tasks that, because of their duration or nature, generate low exposures. But if you are milling asphalt on a regular basis, you're going to be covered by the rule. Now, as I mentioned, Table 1 lays out specified control measures for 18 common construction tasks, and employers who follow those control methods don't need to concern themselves with the permissible exposure limit. They don't need to do anything to measure exposures. It's what we view as the easy way to comply with the standard, the simple way to comply with the standard, and we anticipate that the vast majority of employers are going to follow Table 1. And here's an example of a Table 1 entry. And this is getting at small drivable milling machines, less than a half lane. And what it indicates is that if the employer uses a machine equipped with supplemental water sprays and uses water combined with the surfactant and follows the procedures to operate and maintain the machine that will minimize dust emissions, no respiratory protection would be required. So if the employer does that for small milling machines, they've done what they need to do to control exposures. Here's the entry for large drivable milling machines, those that are half lane or larger. And this is just a portion of it. You'll see the rest of it on the next slide. It didn't all fit on one slide. But this is broken out to indicate for cuts of any depth on asphalt only. And that's using a machine equipped with both exhaust ventilation and supplemental water sprays to suppress dust. And again, using those controls, the employees who are working on that task would not be required to use respiratory protection. The employer would not need to concern themselves with the Pell or measurement of exposures. The other part of that entry for large drivable milling machines gets at cuts of 4 inches or less on any substrate. either asphalt, concrete, or mixed substrates. And that lays out a couple of options there, either using a machine with the exhaust ventilation drum and supplemental water, or just the supplemental water combined with the surfactant. And again, in either case, if the employer is implementing those controls, no respiratory protection would be required for the workers who are performing that task. Now, the question has come up, what does that mean if you happen to be milling a substrate that is concrete or mixed and more than 4 inches? And that means it's not covered on Table 1, and the employer would be put in a position of following the alternative exposure control methods, which we'll talk about in a minute. But you can see the list of Table 1 entries. It gets at those 18 common construction tasks. Another one that folks in the room might commonly be involved in is use of the walk-behind milling machines and floor grinders, but it covers a lot of other tools. For example, jackhammers, if you're ever in a position where you have to, for example, take out a sidewalk or a concrete curb in order to do the work you're doing. Those are covered by Table 1 entries, and there are specified controls for those as well. And when we talk about the Table 1 entries, we talk about full and proper implementation. It's not simply having the controls there. The controls have to be functioning properly. And we also talk about employees engaged in Table 1 tasks. And what that means is that if you have helpers involved in the task, they're considered to be engaged in the task. So when you see that entry that says no respiratory protection required for the milling machines if the controls are used, that applies not only to the operator of the machine, but to tenders and others who are involved in that task as well. They're all grouped together and considered to be engaged in the task. But if they're not involved in the actual task there, and are what we refer to as bystanders, they're not covered by that Table 1 entry. Now, for some of the entries on Table 1, respiratory protection might be required, and that's for situations where the controls would not be effective in limiting exposures in most cases to the new permissible exposure limit. For those milling machine operations, of course, there is no respiratory protection requirement if the controls on Table 1 are being used, but you might run into that if you're doing other tasks or if you're milling on concrete. And the alternative exposure control methods involve complying with the new permissible exposure limit of 50 micrograms per cubic meter of air as an 8-hour time-weighted average. The previous permissible exposure limit for construction was approximately 250 micrograms per cubic meter of air, so it's a substantial reduction. There's also something referred to as an action level, and that just triggers some requirements for exposure monitoring. And employers who are following the alternative are required to assess exposures if they're going to exceed that action level. And there are a couple of alternatives for doing that. We call them the performance option and the scheduled monitoring option. The performance option allows employers to rely upon any body of data they can reasonably use to assess exposures, so long as it's sufficient to accurately characterize those exposures. Employers can use things such as industry-wide data, or can use methods that aren't typically used to measure respirable crystalline silica exposure. For example, you can get an instantaneous dust reading meter that will indicate the respirable dust content in the air. It doesn't indicate the respirable crystalline silica content specifically, but if you know the percentage of the dust that is crystalline silica, or want to make an assumption that it's all crystalline silica, that instantaneous meter can be a very simple way to gauge what the exposures are during a particular task. And I know Howard's going to be talking a bit more about use of objective data in the following presentation. But it is an option that we anticipate a lot of employers will use when they're not able to follow Table 1 or choose not to follow Table 1 in order to assess exposures. The other, I mentioned objective data that can include a wide variety of different types of data. It just needs to accurately characterize the exposures. There is also a scheduled monitoring option, and this is sort of the simple no-brainer if an employer wants to use the alternative and not think about what they need to do because it requires initial monitoring, and any subsequent monitoring would be based upon the monitoring results, such that if the initial monitoring indicates exposures are below the action level, they're done. If the monitoring results indicate exposures above the action level but below the Pell, repeat within 6 months. Above the Pell, repeat every 3 months. And there are also requirements that the samples be analyzed by labs that follow certain procedures. Those requirements don't kick in until June of 2018. Now, when following the alternative, we have a provision in the rule that requires that employers follow what we call the hierarchy of controls, using engineering controls rather than respiratory protection, and only using respiratory protection once all feasible engineering and work practice controls have been used. And we hear from a lot of employers who look at the controls and say, these cost money, it would be easier for us to simply put people in respirators and not install these controls on our machines. And there are reasons why that isn't allowed. The engineering controls are effective in protecting groups of workers. They're much more reliable. When you get to respiratory protection, it is an important means of protection for workers in a lot of cases, but it's also a big challenge for employers to ensure that respiratory protection programs are implemented properly, that employees are using the respirators properly and consistently. Little things like a few days beard growth can interfere with the face seal on a tight-fitting respirator, and it's difficult to ensure that a lot of workers are not encountering those types of problems when using respiratory protection. Respiratory protection can also interfere with communication and vision, things of that nature. There are a lot of reasons why engineering and work practice controls are the preferred method of controlling exposures. And you can see some of the engineering controls. For construction, we're typically talking about wet methods, and you can see water being applied to blades in these pictures, or vacuum dust collection systems, and you can see vacuum dust collection systems on these tools. In the case of your milling machines, you're looking at either of those alternatives, or in some cases, both. The respiratory protection requirements, when they apply, employers must follow OSHA's respiratory protection standard, which requires, which applies to all respirator use. It requires a respiratory protection program and medical evaluations for employees who are using respirators. And that's really getting at any situation where the engineering and work practice controls are not limiting exposures to the permissible exposure limit. There are also restrictions on housekeeping. Because dry sweeping and dry brushing and use of compressed air can contribute to exposures. Those are generally prohibited where wet methods, such as wet sweeping or HEPA vacuuming, is available and feasible. There's a requirement for a written exposure control plan, and what that does is lays out the tasks that involve exposure, the controls that are being used to limit exposure, and in cases where respiratory protection is required, procedures to restrict access to those high exposure areas. Of course, if you're using the milling machines following Table 1, no respiratory protection would be required, and so that requirement to restrict access would not apply there either. There is a requirement for a competent person to ensure that the controls are working properly, really looking at an individual on any particular work site who is capable of identifying hazards and capable of ensuring that the controls are working effectively. And they need to make frequent and regular inspections to ensure that that is actually happening. There is also a medical surveillance requirement that kicks in certain situations. That is where employers are requiring employees under the standard to wear respirators for 30 or more days per year. Again, with the milling following Table 1, respiratory protection would not be required, so the medical surveillance requirement would not generally kick in. But you could have situations where you're dealing with concrete, where exposures would require use of respiratory protection, or performing other tasks that would require respiratory protection, so that could potentially apply in those situations. And there are some specific requirements that come with that. And what happens is the worker receives a report from the medical provider that includes any findings from the medical exam, any recommended work restrictions, and any recommendations for further evaluation and treatment. The employer receives an opinion that just describes limitations on respirator use, and any additional information is only included if the worker provides their written consent. There are requirements for hazard communication, getting at training workers of the health hazards associated with silica, the tasks that involve exposure, and the controls that are in place for that, as well as the identity of the competent person. And record-keeping requirements would apply for air monitoring and objective data and medical records. Of course, if you're following Table 1, you're not required to develop any air monitoring data or objective data, and the medical records would apply where medical surveillance is required, if no respiratory protection is required, such as if you were following the Table 1 entries for milling machines, you wouldn't have any medical records to keep either. And OSHA began enforcing the new rule on September 23rd of 2017. So inspectors are out there enforcing that now. There was a memorandum that came out just prior to that September 23rd date. And what that indicated was that for the first 30 days, OSHA would be taking good faith efforts into account. So for employers who are attempting to comply and making good faith efforts to comply with the standard, OSHA was providing compliance assistance efforts, and that is continuing. We anticipate that there will be some interim enforcement guidance coming out prior to the 23rd of October. So any day now, you should be seeing some interim enforcement guidance from the agency indicating what procedures inspectors are going to be following when conducting inspections under the Silica standard. And down the road, we expect a more lengthy document, what's referred to as a compliance directive, that lays out in greater detail the procedures for inspection and interprets a lot of the provisions of the standard. And I mentioned the requirements for lab analysis don't kick in until June of 2018, but that's really something that the laboratories need to deal with. Any employer just needs to get some assurance from the lab they're working with, to the extent they have samples analyzed by a lab, that the lab is complying with those requirements. Wanted to mention a web page we have. The easiest way to get to it is to go to osha.gov/silica. And we've got a lot of information there to assist employers in complying with the standard. Fact sheets, some FAQs, and we're looking at continually building up the FAQ inventory because we get a lot of questions. There are some videos there, but particularly there is a small entity compliance guide for the construction standard, and that addresses a lot of the questions that people have about the standard. It's a good reference source if you have any questions about the standard. As you're attempting to comply, you can use that as a reference source. And there is also an appendix to the standard that's intended for the medical providers. To the extent anyone is providing medical surveillance under the standard, their medical providers can refer to that appendix, and it provides additional guidance on silica-related diseases and the medical surveillance process. And I'd be happy to try and address any questions that anyone has.
What is the definition of a surfactant? What is allowed as a surfactant?
I'm sorry? The standard does not define that. My understanding was that it's commonly a dishwashing detergent. I think Dawn is commonly used. But I believe the NIOSH guidance might get at that to an extent. Howard, I don't know if you might be aware of that.
There's some commercial vendors now that will supply these so-called surfactants. We do know that something as simple as Dawn, the detergent works well. If you want, we look at some kind of meter rates, or however, whatever the term is for how much you would need, like an ounce or two per 100 gallons kind of thing. They do work, and what they do is they kind of make the dust clump together a little bit more. So they are very effective. They're pretty easy to do. So they don't mess up the machinery. So.
Yeah, and it's really quite surprising. Was reading through some of the background materials prior to the meeting here and saw where the water with surfactant was about 4 or 5 times as effective as water alone in suppressing dust. Really kind of amazing.
Anything else?
I just had one on compliance. You said there were, I mean, how many inspectors are out there now? You said now they're out actively inspecting job sites. I mean, with over 4,000 to 5,000 milling machines in the United States, I mean, I'm just wondering how you're going to do that.
OSHA in general does not get out to the vast majority of work sites. If you look at OSHA, federal and state together, I think we have a bit over 2,000 compliance officers in the field, and there are literally millions of workplaces. I forget the estimate. I think it's in the 8 to 9 million range, and I've heard estimates that it would take OSHA inspectors something like 130 years to visit every work site. So it's really in response to employee complaints or things of that nature. There are programmed inspections, and there has been an emphasis program that OSHA has had for a number of years, where I think 2% of OSHA inspections were targeted silica inspections. But of course, that's getting at silica in general, construction, general industry, and not focused on milling in particular. It is uncommon for an OSHA inspector to show up at any given work site, but the standard is laid out in such a way that anyone can look at Table 1 and quickly determine whether an employer is following those requirements. So it becomes pretty apparent if an employer is not following Table 1, and an employee would know if they're not following Table 1 and they're not following the alternative, because under the alternative, employers would inform employees of the exposure assessment results and the controls that are being used. So everyone's pretty much aware whether an employer is in compliance or not in compliance.